Okay, a little bit later in the episode, I'm going to tell you more about the hormone fixer because I know you're dying to know. This little bad boy supplement that I created, if I do say so myself, is amazing at so many things, so many benefits. So it raises your natural testosterone, ladies, that GSD hormone. It helps with weight loss. It helps improve insulin sensitivity. It helps with anti-aging. It increases your own growth hormone, the anti-aging hormone that helps with the wrinkles and the stamina, energy, focus, brain. It also helps with your mood and lowers your response to stress. So you're just going to have to wait a little bit more. We'll tell you more about it. The hormone fixer. So this is going to be a game changer for you. And you can probably hear the excitement in my voice. The latest introduction, the latest member of the family to the Fixer line is Metabolism Fixer. And this, oh my God, I formulated this just for all my people out there that need to lose weight, that need help in the weight loss department, that can't lose weight no matter what they do, that feel like they have a slow metabolism, and that might be thinking of trying all those peptides out there, you know, the Beverly Hills soccer mom drug of choice for weight loss peptides. Or even if you're on them already and you're like, man, these are really expensive and I'm still not losing weight, add in Metabolism Fixer. Here's what I did. I took the power of T2, which increases your basal metabolic rate while you are sitting there watching Netflix. You're burning fat while you're watching Netflix. I combined it with a very unique patented ingredient called Suppressa. Suppressa has multiple clinical trials backing its efficacy in reducing your appetite, decreasing snacking, and providing way more control over your food intake. It is amazing. We also see improved emotional well-being, just decreased food cravings all around, reduced hunger, and weight management. Add on top of that, we have green tea extract, we have purple forest purple tea extract, both of which affect the metabolism in a very positive way without the jitters of normal fat burning supplements out there from the 1980s and 90s, right? The ones that made you feel like you're having a heart attack. You will not have that in any of my supplements, Thyroid Fixer or Metabolism Fixer. But Metabolism Fixer, ooh, yeah, we kicked it up a notch. It is in powder form, so you can drink it through your day. It's going to flavor your water. We got orange crush and refreshing citrus. I love them both. It is going to keep you under control all day long. So you throw a couple scoops in your water bottle in the morning, throw a scoop or two in your water bottle throughout the day. You will have fat burning and appetite control the entire day for what? An eighth of a price of the peptides? Oh my God, you can't go wrong. So grab some Metabolism Fixer today. Please let me know how you do on it. I am super excited for you. Super excited. Dr. Gupta, thank you so much for joining us today. I love having thyroid specialists on because we can put our brains together and really dive in and talk all things thyroid. So I absolutely love it. Now, for my listeners who don't know you, I want to hear your story because we all of us in this thyroid space have a story that brought us here. So I want to hear your story. What brought you into dealing with thyroid and Hashimoto patients?
So thank you so much for having me on the show. It's a pleasure. You are doing great work, of sharing hope with each and every thyroid patient. So it's a pleasure over here sharing some of the insights. So my story actually starts off, after doing my family medicine residency. I was working in a very busy private clinic. And then just a few years into my practice, I started having a lot of issues. Started off with the gut problems. I was having this horrible stomach pain, and it would be random, hitting me directly when I was working in the clinic. Will last for hours and then will suddenly go away. I was not able to pinpoint what was exactly causing it. I thought it was acid reflux, taking medications, but still not getting better. The pain was so severe at some times that I even thought about going to the emergency room. But I knew emergency room doctors could not do it. They might just give me some, cocktail of medicines, and then they might just send it back. So after suffering with that for several months, I started having fatigue issues. I was so tired that I had to take a nap during day just to function in the clinic. I was brain fogged by the end of the day. Just I could not function anymore. I was gaining weight like crazy without even changing my diet. So I was having all those issues and I could not pinpoint or could not improve my own health. So that's why I thought, well, I'm not a smart doctor. Let me take help for all these different specialists. I went, to all these different specialists, did all different kinds of testing, blood work, ultrasounds, endoscopy, food, allergy testing, everything. Everything was negative. Nobody had any idea what was going on. They added more medications. I was taking 6 medications at one point of time, and nobody had an idea why I was taking these medicines. I was still not feeling better. I was feeling hopeless and miserable at the time. That's the time when somebody introduced me to functional medicine. I got certified into functional medicine. I looked at my root cause. I found my root cause, and I started implementing a plan. Within a few months, my pain was completely gone. Within 6 months, I was off all medications. I lost 40 pounds. Mm-hmm. My energy levels were so high that even I took place into a 5K rugged maniac. And I was not an athletic person in my whole life. So for me to do that was a big change.
Big deal. Mm-hmm.
So that completely transformed my life. Then after that, actually, I was working at the Cleveland Clinic, alongside Dr. Mark Hyman.
Yep.
And what I saw was that I was seeing all these thyroid and Hashimoto's patients, and each and every one had similar issues like mine. They were all gaining weight. They were all brain fogged. They were all tired. And the bigger part was that they were all taking the medicine that the physician was telling them to do and still not feeling better. So I was able to immediately connect with them. And I was like, I need to do something for these folks to get them better. So I started researching into Hashimoto's disease. And that's where I found a protocol that implemented for a lot of folks and they got better. So that's where my journey from my issue started and landed up to Hashimoto's patients.
Wow. I always think it's so powerful when someone has walked in another person's shoes. So as you're helping your patients that are suffering, they're in the beginning stages, just like you were with Hashimoto's, you're able to pull in your own experience and literally say, listen, I get it. I was on the Band-Aid medications before. And even as a doctor, I took them because that's what you do. And that's standard of care for all of these symptoms that I had. But now you're in this space realizing that they were Band-Aids and no one was actually getting to the root cause of your own problem. I just think that that's so amazing because it makes you, as you know, such a better practitioner toward people that are coming to you for help. So I absolutely love it. So can you tell us why, when we're talking about Hashimoto's, and we know I talk about this all the time on this podcast about suffering with symptoms. What is your opinion? Because I always like getting opinions of other thyroid specialists. What's your opinion on why people continue to suffer with these symptoms? Like you mentioned the weight gain, you can't lose weight, the brain fog, the poofiness, the stomach issues, a lot of GI issues. So what's your opinion on that?
Right. So just going back to Hashimoto's, like the listeners might know about it, but Hashimoto's is an autoimmune condition where antibodies are destroying the thyroid gland, which ultimately leads to low thyroid. And that's where people get started on a thyroid hormone replacement. Now, the research tells us that more than 60% of patients, even though they are taking the thyroid medicine, they still continue to suffer from symptoms. So that prompted me to look deeper on why that is happening. So what I found was that there is an important structure in each and every person's body called mitochondria. Now, mitochondria is a small organelle which is present in each and every cell of our human body, and that gives us, it has a lot of functions, including energy, including heart health, brain health, all of those things. So the research actually now shows that in a lot of Hashimoto's patients, this mitochondria is not functioning properly. Now, there is a connection between thyroid and mitochondria that we have known for a very long amount of time. Now, thyroid and mitochondria connection could be compared to like a gas pedal and an engine in a car, where the gas pedal is a thyroid gland and your engine is your mitochondria. So the more the gas pedal we push, the more the car should move forward if the engine is doing great. But what happens in Hashimoto's patients is that there is a disconnect in between this gas pedal and the engine. Now, by giving the thyroid hormone, we are pushing more gas pedal with the hope that the engine will work. But if the engine is broken, the car will not move forward. And that's what happens. So I call this as a mitothyroid connection. And this connection is broken in Hashimoto's patients. So by giving this a thyroid hormone, this connection doesn't get better. And that's the reason people continue to suffer from symptoms. So we have to work on the underlying problem of first finding out why this connection is broken. And then second of all, fixing not only the thyroid, but also fixing the mitochondria and the connection at the same time.
Absolutely. I completely agree, because I don't have an issue with thyroid hormone replacement therapy, especially if they're in the later stages of Hashimoto's and they have to be on something to replace those hormones that are just no longer being properly made. But at the same time, you and I hear so often, but I'm just not getting better, but I'm still suffering with this symptom and that symptom. And why am I still tired? And why can't I lose weight? So I completely agree that we have to look deeper at the function of the mitochondria to see what exactly is going on. So what have you found in practice to be some of those causes that really, for lack of a better word, screw up the mitochondria and keep people in a state of having symptoms?
So I figured out 5 major root causes which leads to this destruction of mitochondria. So the very first root cause is food sensitivities. There are several foods, which are good for mitochondria, but there are several foods which actually start destroying the mitochondria. Mm-hmm. Now, obviously, these food sensitivities are totally different from food allergies. That's what we talk about. We talk about these food sensitivities, where like major players are like gluten, dairy, soy, corn, sugars, all of those are mitochondrial killers. So the food sensitivity is a bigger issue, which is the number one. The second that we deal with is what we call a stress. Whether that is physical stress, mental stress, psychological stress, any kind of stress that a person goes through for a longer amount of time, it negatively impacts the mitochondria and starts destroying it. The third thing is nutritional deficiencies. Now, mitochondria is a powerhouse of the cell. It cannot produce power if it doesn't have the right nutrients. It does require a lot of nutrients. A lot of times, again, Hashimoto's patients are deficient in those nutrients. So it doesn't let mitochondria to function properly. That's the third major root cause. The fourth one is toxins. Our environment today is laden with so many toxins, whether those are heavy metals like lead and mercury or arsenic, or mold toxins, or environmental toxins like pesticides and other things. The mitochondria is the most sensitive organelle in our body to the toxins. So all these toxins start destroying the mitochondria. And the fifth and the last root cause is infections. Several infections, whether the Epstein-Barr virus infection, several parasites in our gut, or any other viral infections can lead to the destruction of this mitochondria. So these are the 5 major root causes which I've identified lead to the destruction of mitochondria.
I love this because it breaks it down so simply for people to understand. So I want to talk just a little bit on each of those 5 causes. So with food sensitivities, I'll give you my take. This isn't something that we talked about off camera at all. So I want to just hear your pure take on this. With food sensitivities, you had mentioned, the corn, the wheat, the soy, those are the big ones that most people are, especially those with autoimmune, are very sensitive to, and they can have that reaction. They can have that autoimmune flare when they eat them. But when it comes to testing, I'm not a big fan of the food sensitivity testing because I see numbers all over the board. It could be that they just had eggs 5 days in a row and they test positive for eggs, or that they use almond flour to cook because they're keto and they test positive for almonds. So what's your take on finding what the food sensitivities actually are in each individual?
And that's a very good point that you brought up. I'm in the similar boat that we do not have a perfect test for checking for food sensitivities. And I tell that to each and every client that I work with. I said, yes, you would like to do a test, but let me tell you that the test is not perfect. So there are caveats involved in it. So that's where certain foods, which I know that, they are like, triggers for Hashimoto's, we remove those. Right. For the rest of the others, I use the testing as a tool. not as like, a perfect thing for me. So let's say if I order a test and 10 things comes back as high levels. So I tell people to keep an eye on those 10 things, not that, okay, we'll remove those 10 things right now. What I tell them is that keep an eye and see what you feel like when you're eating those 10 things.
Right.
What is your body telling you? And if the body is telling you that, okay, you're reacting to those or they're not your friends, then yes, absolutely remove them one at a time. Or sometimes they say, okay, well, why don't we remove a couple of those and see how you do for a couple of weeks and so. And then if you feel better with that, okay, we have an answer. So that way it's a more individualized approach that I follow. And it also depends on a person. Some people come to me that they're sensitive to everything. It is very difficult for us to get them better, especially people who are like mast cell disorder patients. They're sensitive to each and everything. So for those, sometimes, yes, I go on a little bit more on the stricter diet by removing those, let's say those 10 things, so that if we can calm their body down. But for majority of the folks, first of all, I don't recommend testing to them. But if they want to, and if they really want that, I do the testing, but then I kind of follow that on an individualized basis.
I'm so happy you said that. It's just so refreshing to hear another practitioner say that, because at the same time, you could have someone, the food sensitivity testing could backfire on your patient, because you could have it not come back positive for gluten or wheat. And then the person thinks, oh, I can eat it because it didn't show up on the test. And now they're messing themselves up, causing all kinds of autoimmune flares on the side because it didn't show up as a positive marker on that food sensitivity test. So I'm beyond thrilled that you mentioned that. And then you talked about stress, especially nowadays, Dr. Gupta. Oh my goodness. People are just so stressed out over everything. I mean, we have the basic stress of life that we all have. And then we have the last couple of years piled on top of that. Are you measuring cortisol, or are you just kind of looking at that overall picture of what people are dealing with or what they've dealt with in the past?
So each and every person that works with me is going to go on a stress management protocol, period.
Yeah.
Doesn't matter, like, because a lot of people, they come to see me and they say, oh, stress is not my problem. I handle it really well. And I was like, well, you are probably the first person who needs stress management.
Yeah.
Because the reality is that we all need it, right? You and me, like have dealt with our own health issues, and stress was a very big trigger for me also. So even till yet, I have to do some stress management techniques, because, like in the modern world, we have forgotten just to take a pause, right? We are always on the go.
Yes.
So those stress management techniques are basically the pause that, we need in our life. So that's first thing, that each and every person should do it, whatever form they want to, deep breathing, meditation, yoga, relaxation, whatever they want to do, but something needs to be incorporated. But yes, the testing is the next piece. In some people, I do check their cortisol levels to kind of give me an idea of how bad their adrenals are. Because some people, their adrenals are completely burned out. So I have to deal with it in a different way. And some people, their cortisol levels are so high, especially in the evenings, that they're not able to sleep with it. So then again, we have to do certain different things for that. So definitely testing is helpful, but I think each and every person definitely needs some stress management in their life for sure.
I completely agree. And we know that stress, if someone has not been truly diagnosed with Hashimoto's, stress is that one thing that can turn that light switch on. It can flip the switch from off to on. And when we're talking about stressors, remember, even pregnancy is a stressor. Hormonal changes in women, that's a stressor. Low testosterone is a stressor. So you have the stresses of life, and then you have the stresses internally. So that, I love how things connect together. So that number 2 could actually also connect to number 5 and flip on an infection like Epstein-Barr virus and turn that into an active state. So everything is connected. Everything is so beautifully connected. Nutritional deficiencies. What specifically are you looking for with the deficiencies?
So some of the basic ones, which almost everybody knows about these days, are like vitamin D, vitamin B12. We already know about that.
Yep.
Then the second thing, for the thyroid specific, zinc and selenium are important minerals that we are looking into. Difficult to check those levels, but those are important things. The next one is magnesium. Very important mineral needed for both thyroid and mitochondria. And the good part is that we do have testing available to check that level. So that's what we are looking at. Then comes this mitochondrial specific things like coenzyme Q10. We know that that is very important to function with the mitochondria. Then comes the B vitamins. All the B vitamins again are so important, not only B9 and B12, but the other ones are important to look at how the mitochondria is functioning. Yeah. Then we're looking at antioxidants like vitamin C, because that saves the mitochondria from destruction of, different oxidative stress. And a lot of people are deficient in vitamin C these days. Mm-hmm. So those are the major vitamins that we are looking at, and the omegas. Yes. So again, omegas are very important for the functioning of generalized body, and again, safeguarding the mitochondria from destruction. So looking at the omega-3 levels in a person to kind of know whether they are in good range or not. So those are the things that we look for in majority of the Hashimoto's patients.
And what are your thoughts on iodine? I love asking thyroid specialists their thoughts, because we're pretty much in the functional space split. 50% say no, 50% say yes. So I like asking my guests, what are your thoughts on iodine?
So I don't prescribe anybody supplements for iodine anymore, because, I again strongly feel that the research does suggest that too much and too little both are problems. And we're living in a world that, too little is not often that we see. The problem is that there is no perfect test to check for iodine. So we all have to go with our gut feeling. That's the only thing. So generally, I do recommend people, just to have a very healthy diet and include some foods which are rich in iodine. So never go with supplementation, but I do recommend them foods like, the sea vegetables and the seaweeds and things to include, like, off and on in their diet to get some iodine in their diet. But I don't recommend supplementation anymore.
See, I'll still recommend supplementation, but just very minimal. Like you said, I think iodine got a bad reputation when we were talking about the practitioners that were using high dosing. And then you would throw someone into a thyroid storm, or Hashimoto's would actually get worse. People would go more hypo. I think if you can find that nice middle ground, that's where I land with iodine. But I wanted to kind of put you on the spot there and actually ask you about it too. So I'm glad we talked about it. And then toxins. Oh my goodness. Like you said, toxins are everywhere. Of course, we talk about them on this podcast too. They just impact the body so much. And we could get into, the liver and how we need the liver to process hormones and methylate hormones and convert T4 to T3. What do you tell your patients about toxins? How far do you have them eliminate them from their lives?
So again, it's very difficult to remove toxins completely. That's the first thing I tell all of my patients, because everybody gets so much stressed out. Oh, what about this? What about that? There's so much toxins in my environment. I said, well, there'll be toxins in the environment. We cannot do anything. Doesn't matter if I keep you in a bubble, and then, not having exposed to you, still will be toxins.
Yes.
So what I tell them is that it's a process. Start working with the worst things which are affecting your life, and then go down the route otherwise. Mm-hmm. So most of my folks, what I'm seeing is that a lot of them are being exposed to mold toxins. Mm-hmm. So that's what I'm talking with them a lot of times about what they can do to remove mold toxins, how to detect them in their environment. And the second is heavy metals. A lot of people actually are high in mercury. Yes. I'm seeing it all the time, or high in lead levels. One of the things which I noticed was that a lot of people are taking these fish oil supplements from over the counter, and they're high in mercury and they have no idea about it. And I'll tell them, your mercury levels are high. Either it is coming from dental fillings, which they don't have anymore. So I said, okay, well, maybe it's coming from your fish oil supplement. And a lot of people get very astonished that they had no idea they are taking a supplement which are actually cause harm to their thyroid.
Right.
That's where it's very important to know, first do no harm. So get good quality supplements which do test for mercury levels so that you don't get harm for that. So heavy metals is certain things. Water, again, a very important indicator or a toxin exposure, especially for lead. A lot of people, even though, they're using tap water, they might be using tap filters. That is not enough to remove lead. So I always tell them, get good quality filters, if possible, reverse osmosis filters, so that you can remove all toxins, because, you never know what that water is coming from. And then we come at, removing toxins in the personal care products, because we know that females use so many personal care products, again, laden with toxins, lead, mercury, whole bunch of things which are added to them. And then more than 200 toxins or more than 200 products, a female uses each and every day on their skin.
Every
Right.
day. Yeah.
So those are the things, that you work on. So, but that's very difficult to change. Like if I talk to females, okay, well, you need to kind of completely change those 200 products the very next day. That is not going to happen.
Right.
So I tell them it's a process. So start working with a few things. So that's why cleaning up, the diet, getting organic, cleaning up, water, cleaning up their air. Those are the things we get started off with. And then working on the personal care products after that is what I generally do.
And see, once again, we're in agreement. It totally is a process. That's what I tell my patients too. I remember the day that I decided to go through just my face wash, body wash, everything that goes on your skin after a hot shower. Because when you think about it, your pores are open. Anything that you put on your body or on your face is going to be absorbed in. And I turned over the really, really expensive medical grade from a plastic surgeon dermatology office line that I have. And I saw paraben, fragrance, paraben. I went, crap, now I have to throw this out. And that's hard. When you spent hundreds of dollars on something, it's hard to do, but you have to think about the long-term effect. You have to think about if you're doing all of these things to improve your health and you're doing all of these things to improve your thyroid function, which is the master gland. Okay, yeah, you might have to toss out a couple $100s of products, but that's okay because in the long run, you're doing your body a service. But it is a process. I completely agree. Total process. And the mercury fillings, I'm actually amazed at how many people still have them. So I don't know what you tell your patients, but I tell them, listen, don't do it like I did back in 2006 when we knew that the fillings were bad. But I went to my regular doctor. I said, unless they come in a hazmat suit to take out those fillings, you're not in the right place. So yeah, I'm amazed. Do you see still a lot of your patients with amalgam fillings?
Absolutely. Yeah. Again, like I still like some of the young folks, even have those, like those mercury fillings. So I'm very kind of surprised with that. And again, as you said, a lot of people might be listening to things online and they suddenly feel that the mercury fillings are bad. They will go to the regular doctor or the regular dentist, and then they will get them removed, and boom, the next day, actually, they feel even worse.
Yep.
So I always recommend, well, you need to go to a biologic dentist to figure out the safe way of doing it, and make sure that you're doing things that will optimize your detox before, during, and after those fillings being removed. Because even though the safest procedures, you still will get some mercury in your system. Yes. So unless you are optimized for the detox, you're definitely going to have those, mercury fillings going into your system. So it's a process. So first of all, finding the right dentist who knows what he or she is doing, and then definitely working with a functional medicine physician who knows how to optimize your detox before, during, and after is also key.
100%. And sometimes I ask these questions and bring it up just so my patients can hear it too. Because sometimes, I always say this, it's one thing if I'm sitting there with them and I'm telling them over and over, do this. And then I bring on a guest and I go, did you hear that interview with Dr. Gupta? I want you to go listen to it because he said the same thing that I did. So I like it when I have somebody to back me up. When you hear things multiple times, then it tends to stick. Okay, moving on to infections. Epstein-Barr virus, a big one. I just had mine tested last year for the first time. That's the problem with the business that we're in. We don't test ourselves enough. So I tested mine for the first time and there it was. And I went, oh, look at that. It wasn't active. It was dormant, but I do not remember ever having mono. It just must have been a really bad cold. So how often are you seeing EBV and what other infections are you seeing with your Hashi patients?
So EBV is very common. As you said, almost each and every one of us, would have been exposed to it. We just don't know or we just don't remember about it. The question is not having EBV. The question is that whether it's the reactivation of EBV, which is causing the trouble for Hashimoto's patients. Because if it is laying dormant, we cannot do anything. There is nobody on this earth which can remove EBV from our body. It doesn't matter what supplement or therapy that you take. Mm-hmm. But what we need to do is that we need to make our immune system so strong so that it can keep the EBV dormant. So sometimes, like people are not getting better, and I do feel that there is a reactivation of EBV, which is happening. So we order those complete panels, not just the monospot test, because that is useless. We need to check all the different panels, the IgG, the IgMs, the antigens, the nuclear antibodies and antigens to see whether there is a reactivation or there is an immune dysfunction which is happening, where their antibody levels are really very high. That gives us an idea, okay, well, the body is fighting against it. So that's one thing, sometimes we use that. The other ones which I see is that parasites. Gut related parasites are such a big thing. Again, like, I'm so surprised that so many people have parasites in their gut and they have no idea about it. Their gut, they don't have any gut symptoms. They said, oh, my gut feels perfectly fine. I said, well, let's check for the parasites. And boom, I see parasites which are again causing that issues.
Mm-hmm.
And the last one are those chronic infections, like, we look those Lyme disease, Bartonella, Babesia, all of those infections that we can lead to, reactivation or activation of Hashimoto's. Mm-hmm. So we check for those also if again people are not getting better.
Absolutely. And I had Babesia as well. That was another one that randomly got tested. And I was like, look at that. It's some kind of Utah tick, and I haven't been in Utah yet. So the take home is, for myself, I was just looking to look, but I'm optimized. I feel great. I don't have any symptoms. So like you said, Dr. Gupta, there's nothing I'm going to do to rid my body of that. It's just kind of, if you had chickenpox as a kid, you have that virus in your system. At any point of time, it could activate and become shingles. Same thing with EBV or any kind of other tick-borne illness. It's there. We don't have to panic about it, but it's knowledge for if at some point in time I do start to feel crappy, I'm going to look at all of those things and see what I need to do and what I need to address, because maybe that is the root cause of an autoimmune flare. So I love that you Absolutely. Look at that too.
Yeah. And the other thing is that a lot of people just order so many different tests, and everybody freaks out once they see some of these test results that are abnormal. And I tell all of my clients is that I'm not treating a lab, I'm treating a person.
Yes.
So if I feel that your clinical symptoms are matching the lab, then it makes sense to treat that particular thing. Random, expensive testing of like $5,000, $10,000, a lot of functional medicine providers are relying on that. I said, well, if I'm just relying on the test, then I'm not better than a computer, because, the computer can also spit out a lot of recommendations based on a lab. Mm-hmm. But I said, I'm a clinician. So I'm going to look at your clinical picture and then match it with the labs which are appropriate and then make a plan. Not just random labs or random supplements. A lot of people just end up taking 20, 30 supplements in a day just because they have done so many testing, and the practitioner just wants to treat everything which they saw on the test.
Yes. And once again, we're so much in alignment. It's one of my pet peeves when I see patients come to me with, like you said, hundreds, if not thousands of dollars of tests, and then laundry lists or bags of supplements that either another functional practitioner put them on, and they don't even know why they're on it. I'll say, well, why are you on? I don't know. The doctor told me to do it and put it on. Or they'll buy something because it was in a forum or a blog or Facebook or an ad. Oh my goodness, it drives me crazy. So I'm very happy you said that, because I'm very much in alignment with that. Let's use minimal testing, and let's look at you as a person and pair up your symptoms with those labs. Exactly. I love that. So we went through your 5 root causes, the 5 destroyers of the mitochondria. That was such amazing information. And like I said, I do want to transition into peptides. We talked a little bit off air about the amazing science of peptides. So we're going to kind of shift gears, and then we will tie it into hypothyroidism and Hashimoto's, and we'll come back to Dr. Gupta's theories and how he treats people and how you can connect with him. So Dr. Gupta, peptides. Ooh, these are so juicy. I truly believe that peptides, which are just sequences of amino acids, I believe that is going to be, as long as we can keep our FDA's hands out of it long enough, or just keep them out entirely, I believe that that's going to be the next wave of treatment, the next wave of medicine.
Absolutely. I mean, peptides are so amazing. I came to know about them, like 3 years ago. And then the more I'm looking into them, this amazing field is expanded and is expanding each and every day. I'm using them for my clients, seeing great results with it. And the good part, which I shared with you before also, is that there is not many side effects to those. These are one of those safest things that I've used in a while. So I said, well, if they're safe, they don't have any many side effects, and if they can potentially be helpful, why not use them? So
Exactly.
definitely I'm using them in my clients. I'm looking more into it. And there's so many peptides which has been shown to be beneficial for a lot of Hashimoto's patients for different things.
There's so many peptides. So I'll just give you the floor. What are your favorite ones? And let's expand on them.
Sure. So first of all, yes, as you said, peptides are basically amino acid sequences. These are naturally produced by our body. So these are not alien things. These are not coming externally. It's basically coming from our own body. Now, the good part is that the research, has been utilized to extract them for a body, and we can now use them as a medicine, basically, completely natural. So at least people are kind of aware of those. So my top four, you will say the first one is thymosin alpha 1. So that's the first one that we use. Thymosin alpha 1 is wonderful. It is an anti-inflammatory peptide. It's produced by the thymus gland, which we have, all as growing up, which helps to shape up our immunity. Our immune system is shaped up by the thymus gland. But basically, as we age, the thymus gland goes away, and we think that your immune system is good shape. But we know that in autoimmune diseases like Hashimoto's, our immune system is completely turned upside down. Our own immune system is fighting our own body and destroying our thyroid. So this thymosin alpha 1 actually reshapes our immune system so that it starts behaving normally again. So it reduces inflammation, which is obviously needed, in Hashimoto's patients. It obviously helps with the regeneration of a lot of immune modulators, which are deficient in thyroid patients, which that is the reason that, we get all these infections, affecting our body. So it strengthens our immune system. So that's the very first peptide that we use. We can talk about much more details, how we use them and what benefits are there. But let me kind of just tell you the four ones. The second one is BPC, 157. So that is the second peptide that, we use a lot of times. The third one is the LL37. That's a new peptide that I'm using a lot, which is an anti-infective peptides, can be used for a lot of mold and other infections. And the fourth category of peptides, I use that often is called CMAX and CLANC.
Yes.
Those are the peptides which are used for anxiety and ADHD symptoms, depression, and all that stuff, which are very commonly seen, in our thyroid patients or Hashimoto's patients.
Absolutely. All right. So let's break those down, then we'll expand a little bit more with whatever time we have. So TA1, thymosin alpha 1, I used so I have to be code wordy here. When I had the big C last August, I injected the entire bottle day one, and then microdosed after that with probably a little bit larger of a dose than what I would normally take for a microdosing. It's amazing. It is amazing for the immune system to really just kick it into gear. So whether it's a viral infection, now would you use TA1 with someone with, let's say, an active EBV?
Yeah. So yes, EBV. So TA1 again is so wonderful. With reactivation of EBV, you use it. Even people who have SIRS, which is the chronic inflammatory response syndrome, which happens with people with Lyme disease or Babesia or Bartonella, or even with mold. I use it very often. Even for people with mast cell disorder, which are really sensitive. So we use it again in those situations. So it's one of those magical peptides that literally you can use it with each and everything that we see. So not only reduces inflammation, it improves your immunity. So you can fight off a lot of viral and other infections. Plus, what it does is that it reduces the histamine tolerances also. So people who are sensitive, and we cannot even give them any supplement, because as moment they put any supplement in their mouth, they start reacting. So we use sometimes thymosin alpha 1 beforehand, and then are using it after for a few weeks. We give them supplements, and magically they actually can tolerate the supplements after that. So it's so wonderful to use, not only for reducing inflammation, but also improving the immunity.
Absolutely. I love TA1. I really love all the peptides. One thing to keep in mind, like you said earlier, Dr. Gupta, is that it's an amino acid sequence. So when we say that this could be the future of medicine, here's the problem. You can't patent something that is natural. So these will never turn into a drug sold by a pharmaceutical company unless they chemically alter it. And if they chemically alter it, it's no longer a natural peptide anymore. Now it has become their patented XYZ drug. So that's why you don't see these in mainstream medicine. If you're sitting there going like, oh my gosh, if these are so amazing, why hasn't my doctor told me about it? Because they can't make money off of it. These are not patentable. So these naturally occurring peptides, sequences of amino acids are so powerful in the body. We're Dr. Gupta and I are saying basically, yes, we can use this like an adjunct to whatever medical treatment that you are on, possibly not replacing yet, unless you're under the direction of your practitioner, your physician, but they're going to help out a ton. So BPC 157, I have a surgery coming up, and maybe by the time people are listening to this, it will already have been done. And I do plan on doing a post-surgical podcast on everything that I use, but I have BPC 157 for right after surgery, body protective compound. It actually starts to heal tissues, ligaments, joints, skin, bone. Well, no, wait, maybe that's TB 500 that does the bone and BPC doesn't, but BPC heals the gut as well. So what's been your experience with that? Will you use that across the board as well with Hashi patients?
Yes, because again, like we know that leaky gut, is a major issue with almost each and every Hashimoto's patients. And BPC is wonderful for helping with the leaky gut and then reducing gut inflammation. So certainly, like we use it over there. It is, as you said, is good for like ligamentous injuries, muscular injuries. A lot of people with Hashi do have, chronic pain issues or joint pain problems. So it is useful for that. It's even shown to be beneficial for protection of the liver, especially for fatty liver issues. Again, a lot of people with Hashimoto's, have fatty liver issues, or their liver is not optimized because they have toxins in it. Yep. So again, by improving that liver function, BPC is again very, very useful. So for all of those things, I use, combination of BPC and TA1 to start off with all of my Hashi patients to give all of those all around benefits, not only from the leaky gut, but also healing perspective. And then reducing inflammation in the body. So BPC is wonderful. Again, no side effects, and then can be used very easily. Now you can actually even have a pill of BPC, so that again, you don't even have to take a shot for it.
Right. And when we're talking about a shot, just for people to have that knowledge, we're talking about an insulin needle. So it goes subcutaneously. You inject the peptide sub-Q. Some of them are intramuscular, but most of them are sub-Q right into your fat. So you pinch a little bit of skin on your abdomen, on your back, on your thigh, and it's teeny tiny little insulin needle. Now, I do have some people that are like, no way, I'm so scared of needles. So in the case of BPC, yes, some companies do have the oral version as well, which is very nice. And CMAX that you talked about as well. I want to do CMAX, and then I want to kind of back to the LL37 because I haven't heard of that peptide yet. So CMAX is also great for anything neurological. So if you're using it with Hashi patients, like you mentioned, the anxiety, depression, the ADD, that, I'll have people say, I think I have early Alzheimer's. Well, no, you don't. You have thyroid brain. So what have you seen with, I have a bottle of CMAX downstairs, but I haven't tried it yet. I know they have a nose spray as well. What have you seen with the CMAX?
Yeah, so CMAX and CLANC, are kind of very, like I will say, brother and sister peptides. So CMAC is the one which actually helps with ADD. It helps with neuroprotection. So people with have brain fog actually improves their mental capacity and brain functioning a lot. So again, those folks, as you said, who feel that they are early dementia or feel that they have brain fog, or they just feel that they cannot focus anymore. CMAX is wonderful. It can improve their cognition levels, just the mental capacity has improved significantly with that. It does have some improvement in the anxiety and the depression piece also, as kind of along with improving their mental cognition. But the CLANC is the one actually improves anxiety significantly. Again, a lot of people, because they have been sick for such a long time with Hashimoto's, they're not feeling good. And they're anxious because they want to get better. They're depressed because they are not feeling good. So that's where CLANC is wonderful by kind of improving their anxiety and depression, kind of improves their quality of life. The good part about CLANC and CMAX is that they are not dependent, right? Because a lot of these psych medications, let's say for ADHD that we use, people get dependent on them once they start using them.
Yep.
Same with anxiety. A lot of the anxiety medicines create dependency. And again, C-Lang doesn't. So that's a good part about them, is that there is no dependency. Use them for a certain amount of time, and then after that, you don't have to use them. And now your body can readjust yourself, and can take care of these things on their own.
And the neurological cognitive peptides are also very neuroprotective. So where something like a benzo that you're taking for anxiety actually has been shown to increase your risk of Alzheimer's, the peptides are decreasing your risk because they are neuroprotective as well. What is this LL37? Did I say that right? I haven't heard of this peptide. I'm fascinated.
Yeah, so this is again one of those new things, which we have been knowing about. So it's this LL37 is a peptide which is an antimicrobial peptide.
Okay.
So again, a lot of folks, I was mentioning with Hashimoto's do deal with mold disorders. And again, the underlying issue with mold disorders is that a poor immune system or causing issues like SIRS, which is a chronic inflammatory response syndrome. So now the TA1 is good in kind of reducing inflammation, balancing the immune system. But sometimes, we do have these underlying infections which are brewing in the system, which are not shown full blown in a medical test. Like some people have dealing with underlying mold hiding in their system, yeast hiding in their system, like sinuses and other places, or some kind of underlying bacteria or parasites which are not able to see on the testing. So this LL37 actually improves, your body's immunity and actually helps you to kill off the bad bacteria, to kill off any kind of viruses that are living in your body, as well as it is antifungal peptide too. So it's one of those antimicrobial things, which again are naturally made by our body, which LL37 is one of those that we can now use and helps to get rid of all those infections. The good part is that there is no die-off reactions. Again, it doesn't destroy your gut microbiome. It doesn't have any side effects to it. So even though it sounds like an antibiotic, but it works in a total different fashion and helps to get rid of all the other infections that might be present in a lot of those Hashimoto's patients in a more natural fashion.
Oh, that is fascinating. I'm going to have to look more into that one. That sounds really cool. And there are so many peptides out. I mean, we could go on and on. We could do another show completely just on peptides, which we just might. But no, thank you so much for touching into and dipping into that world of peptides, because I find them incredibly fascinating. We would keep going with it, but that's just another example of how you really can attack Hashimoto's naturally. Even if you're, and again, even if you are on a little bit of thyroid medication, you don't need all of the Band-Aids, the antidepressants, the anti-anxiety, and then the sleeping, and then the blood pressure and the inflammation and the antibiotic and all of these things that are just Band-Aid medications that you may or may not have been given. There are other answers. It just takes a little bit of digging, takes a little bit of effort, takes a little bit of investment on your part, but it can be done. So
absolutely. And again, you and me know that we are not against medicines. We are regular doctors. We at some point of time, we all have prescribed medicines. So that's not the question whether you are on the medicine or not. The question is that what else can you do to optimize your thyroid? What else can you do to find the root cause? Why in the first place, you got this disease?
Yes.
And what you can do right now to not only safeguard your thyroid for now, but also for your future. Because this thyroid is going to get destroyed time and again. And once, like it has been 10, 15, 20 years down the lane, your thyroid will be completely destroyed. You will have more and more autoimmune disease, because once you have one autoimmune disease, you are going to get a second one and a third one.
Yep.
And then, you get more and more medications. You go on these biologic medications. It's going to completely shut down your immune system, and nobody's going to stop them forever in your life. And there's going to create a host of another problems. So we don't want to go into that rabbit hole. So what you need to do is that right now you have the empowerment of doing things to improve not only your current life, but also your future life.
Absolutely. I completely agree. Well, Dr. Gupta, thank you so much for coming on. And can you tell people who are interested in finding you and finding more of your work, where can they find you?
Absolutely. So I have multiple places I share my content. People can follow me on social media, on Instagram. I do have a YouTube channel where I share a lot of video content and my website. So all of them are on hashtag Anshul Gupta MD, which is spelled as ANSHUL GUPTA MD. So that's my YouTube channel, as well as AnshulGuptaMD.com is a website. I do have a free thyroid quiz for people who can take that will help them to identify what potential root causes they might have, so that at least they are aware of it, then we can start working on it.
Oh, that's amazing. And we will have all of your links in the show notes as well. So thank you so much for your time. I greatly appreciate it.
Thank you so much for having me on the show. It is a pleasure to be here. Thank you so much.
So now that you've heard all about the hormone fixer, I'm going to give you a challenge. If you actually listened to this podcast all the way to the end and you're still listening, you can use the code thyroidfix10, 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 and get 10% off my store. This is only for people that listened all the way to the end. I want to know what you think about my products. Make sure you let me know. Love y'all.